kind of remember everything, right? So as parents, you're doing a wonderful thing by understanding one of the resources that's available to them. I encourage you to have a conversation with your student to just kind of recap a lot of what they've received throughout orientation. And then just to kind of reiterate the fact that, there is this resource for them on campus that they can utilize. I mean, I've been in settings where I've spoken to students at the very beginning, but they kind of just put it away and they forget about it. And then they go throughout their entire college career, usually in their last semester at Cal State Long Beach, they will then be like, oh gosh, I didn't even know that this existed, or I knew there was a clinic, but I just wasn't clear on the information. And I'm hoping that the information that I cover today will help clear up some of those common misconceptions. And as their parent, as you send them off to college, really encouraging them to advocate for themselves, right? You want to be one of their strongest supporters, but we're here to help at the end of the day. We're very student centered. So happy to answer any of those questions that you might have towards the end. So let's see. All right. So student health services. So we are nationally accredited, a nationally accredited facility. We've got licensed medical personnel, and the majority of the services are primary care. We do have our own on-site laboratory, pharmacy, x-ray. I work specifically in the area of health education, so I'll expand a little bit more about that later on. Some of the specialty care services that we offer are sports medicine. So this is big. If you have an athlete, just know that we work very closely with athletics to make sure that they're getting the best possible attention. Gender affirming care, reproductive health, also case management. So I will talk about this quite a bit. It's very important, but oftentimes students perhaps need services that maybe they can't obtain here at the clinic, or requires a different level of care. So we've got wonderful staff that can help them navigate their own health insurance, to find, a solution to their needs. Also immunizations. So I know that we're going to be talking quite a bit about immunizations in a moment. Many of you might have some of these questions, but hey, if any of your students are in need of any immunizations during their college career here, that's certainly something that we can assist them with. Also family pack enrollment services, and we also offer plenty of program offerings around mind, body, and wellness, because that's very important. It's one of our priority areas, looking at the student, not just free from illness or disease, but it's the entire package, right? How are they doing overall mentally? And I'm sure you've been receiving or will be receiving a lot more information about the efforts that are taking place on campus to ensure that your student is very well taken care of, and that they're getting what they need should they ever hit a bit of a roadblock. We want to make sure that you as parents know that they have wonderful resources at hand. So what does it cost to come to student health services? Well, your student has access to the services here at the clinic for free. Essentially, there is a $75 student health fee that's already included in their tuition. Now, there could potentially be some extra costs, out-of-pocket costs for any medications or over-the-counter items, maybe immunizations that they might need to get, some lab tests if they need to be sent out. If it's lab work that can be done in-house, there's, that's a little bit different. But for the most part, students can come in to be seen as often as they need, to check in with the clinician, to get a physical. But we do have our pharmacy here that does carry quite a number of over-the-counter items and medications, and it's very convenient. I always tell students, especially if they live on campus, if you're in need of something Monday through Friday, you could just, walk on over to the health center, walk right in, go to the pharmacy, you look at our over-the-counter items list and just check off what you need. You pay for what you need here on the spot, and it'll get dispensed the same day. And the pricing is relatively cheap, a lot cheaper than maybe, perhaps Target or Walgreens. And it's convenient too for them if it's during the week. Maybe they're walking back to their dorm room after class and they're just like looking and thinking, maybe I'll just stop by and pick up a quick cold care kit, some Tylenol, what have you. Another common question that comes up a lot is like, well, my child is under my health plan, or maybe, your student will one day be working for a company that provides them with health insurance, but they are still a student and all that, but we don't require or bill health insurance. So if they have it, that's great. It's encouraged that they have a plan, but it's not a requirement for them to come to student health services and be seen. And again, the student health fee, this is not a health insurance. This should not replace the need for health insurance, just because, emergencies do come up. Oftentimes services are needed that are beyond what we can offer here at the clinic. So it's always recommended that they do have some sort of plan. And those are things that we can certainly help them out with too. So the hours for the clinic are Monday through Friday. We're open all year, with the exception of some major holidays. But for the most part, we're open 8 to 5 p.m. and then Wednesdays 9 to 5 p.m. It's very easy to be seen here at Student Health Services. You can call to schedule appointments. Walk-ins are welcome as well. Now, what happens when, your student gets sick after hours or on the weekends? Because that obviously happens. We do have an after hours nurse advice line that's available to assist them with any questions that they might have or concerns during the night, weekends, and holidays. So rest assured that if they were to call, they would, then, receive some information how to connect with someone on the spot. And in that after hours phone call, the nurse can pretty much assess what's going on. If it's something that requires immediate attention, they will pretty much help the student navigate the services off campus. Either, hey, you need to go to the emergency room, or you need to get seen right away, or okay, this is perhaps something that you can do in the meantime. Maybe it's Sunday night and it's like, student health services will be open first thing in the morning at 8 on Monday. Try calling then, or, you can, or walk in to be seen. So we're conveniently located on the corner of Beach Drive and Merriam Way. So we're right across one of our nursing buildings. We have a very close relationship with our nursing program for those particular students. And we're right near next to some of the housing, the residential halls. But it's very conveniently located for those students, especially the ones that are in housing. When we talk to them about like, hey, how many of you know where Student Health Services is? They're like, oh yeah, I passed by there on my way to the library. So make sure you have these conversations with them. Hey, do you know where it's at? You know how to get an appointment. Oftentimes it's just trial and error, right? Where they could just walk right in and that's perfectly fine, or they could just call and we've got, wonderful staff that is ready to assist them. I will let you all know, I mean, at the end of the day, many of us are parents ourselves. We've got nieces, nephews. Many of us have had children in college or kind of in that same situation. So we really empathize and we understand that some of these students may not quite know what to do at the very beginning. And so we're very student-centered and willing to help your student whenever a need arises. Okay, so for the 2023 academic year, the requirements for immunizations are as follows. It pretty much breaks it down for you. You can see what the required immunizations are, depending on which category they fall in. I would say that, housing students are the ones that would need to upload proof verification that they've obtained the following vaccines here. And you can see that slightly changing for, the type of student that we're dealing with. So if you already have some questions regarding immunizations, I know some things that have come up already has been with, how do I upload this information? But essentially your student will need to log into their student portal and upload dates for each of the required, immunizations that are listed here. But again, if you have some questions, we'll definitely be answering those at the end of the presentation. What about immunization exemptions? This does come up quite a bit. So there are medical and religious exemptions accepted. And for more information on this, you can just follow the following link or go to our website, CSULB.edu/SHS. Go to the Student Health Services website and just click on the immunizations tab, and it'll give you the direct links to request or to learn a little bit more about these exemptions and whether or not you're interested in one. Making appointments and preparing for medical visits. So as I mentioned earlier, it's very simple to obtain an appointment at Student Health Services. You can call our main line that you see up on the screen to schedule an appointment. And in addition to this, students will be asked to go onto their patient portal. So when they go into their single sign-on, there will be a bunch of little applications, little chiclets, as they like to call them, that will show up on the screen. And there should be one specific for Student Health Services, which looks just like the icon that you see on the slide. So they will go into their, patient portal, and they just need to be prepared to fill in the following information about any allergies that they might have, medications that they might be taking, all of the prescribing details, and overall health history, okay? So this is just something that they'll have to do at some point or another. If they can get this out of the way early on, it makes, their very first visit go a lot more smoother. They don't have to worry about all that, in the moment. Although it happens from time to time, it's perfectly okay. But like I said, they can call or they can walk right in, okay? But leading up to that first appointment, it is recommended that they go on to their patient portal and at least start filling out some of the required forms there. As their parent, as their family member, the best word of advice that I can give you is to have a conversation with your student about any of their overall health history, because ultimately they need to feel comfortable navigating those conversations here with a clinician if they've got concerns. Sitting down with them and just getting them to understand their health needs. As a parent, I'm sure, you've, for the most part, have taken care of all those types of doctor visits, vaccines that they might have needed, any of their prescribed needs and all that. So now it's kind of like, okay, we're turning this all over to you. So really sitting down with their student, making sure that they understand their health history, their prescribing needs, the details, and that way when that first visit comes up, whenever they're ready to come into student health, they feel very comfortable and at ease. In terms of confidentiality, we respect all of our students' right to confidentiality and privacy. So this is very important. Any student that's 18 and older, health information is not given to parents or guardians. Any student who's under the age of 18, they will need a consent for treatment form signed. And this form can be obtained on our website. So if you go to Student Health Services main website, there is a tab that I believe it says forms, and you can just click on that and download that form and just making sure it gets turned in. And so health insurance, I can't stress this enough just because it does come up quite a bit. Again, the student health fee is not health insurance, okay? Having the student health fee already worked into their tuition, it gives them access to all of the services here. Personal health insurance, though, is strongly recommended for any after hours care, specialty care, emergencies. Unfortunately, they sometimes do come up and they're needed. And, one of the best examples I can give you is maybe after a while, your student realizes, well, gosh, I think I might need glasses. They can come in here and certainly talk to someone on how to navigate their own health insurance to locate these services in the community. Um, it can seem like a pretty daunting task to do because health insurance can be complicated, of course. But there's wonderful staff here to certainly help them with that and whatever their needs are. If they don't have an insurance plan, that's something we can also help them out with, tell them where to go, how they can go about that, just so they can see what's the best fit for them. But if they are on your plan, again, giving them a copy of their health insurance card, and just kind of guiding them through that process. But it's okay. Sometimes, the students was like, my parent went through this with me and I still am kind of not quite getting this and that. Not to fret. We do have wonderful staff here that will take some time to sit down with them and help them navigate that a little bit better. Okay, so specifically, I'm in the Office of Wellness and Health Promotion, also known as our Health Education Department, which is inside of Student Health Services. So in the Office of Wellness, we do provide individual sessions in the following areas that you see listed there: workshops, classes, all to really meet the needs of our students. And this is really exciting for us to, whenever the beginning of the semester, gets closer. We're thinking of ways to be out on campus and to promote the services, not just the clinic itself, but also the other free options that they have in regards to health education. So there are wonderful opportunities throughout the semester where we can connect with students through an outreach event, a wellness health fair, and just shed a little bit more light on the things that they can tap into. As a student many years ago, it can definitely be, it's exciting but overwhelming, and usually in that first semester there's maybe a little bit of adjustment that they have to kind of do in terms of their study habits, or how do I make sure that I complete this semester in the best way possible while not losing myself, right? Paying attention to all of my needs, not just free from health, or I'm sorry, free from illness or disease, but making sure everything's intact. And I think I speak for a lot of folks on campus when I say that we've got wonderful supports in place. And it's just about reiterating these services to these students and letting them know it's okay to push the pause button and to lean in on those supports. I will always say this to students, and I have to tell you that this is one of my favorite aspects of my job, is whenever I can meet with a student. And if it's something that's outside of my area of focus, it doesn't matter. It's like, I know who you need to speak to. I'm going to connect you with this individual. And I feel the same thing for everybody. The staff here at Student Health, we're very student centered, and like I said, we have students ourselves, or young kids, and we just try to put ourselves in the shoes of parents and think about what it might be like to have your student not so close to home and just hoping for the best, right? But we do have a lot of these individual sessions. Definitely some support services for quitting smoking or vaping. Maybe there are some students who might be struggling a little bit more in the area of substance use, and we've got excellent staff that can also support them in this area a little bit more. In terms of workshops and classes, we've got different topics, different offerings throughout the semester. And oftentimes we'll, try to gauge the student population to see like what other topics would you like to see. These tend to be the most popular ones. But summertime, we're open, even though it's a little bit quieter here in the clinic, especially for our health education team. It's a time that we use to really prep and plan for the fall semester and to think about how are we going to connect with our students to make sure that they understand everything that's available to them, that it's free, and that it's okay to just raise their hand and say, I need a little bit of support. There's no shame about that. Okay, our contact information is up on the screen. You can send us an email at wellness@csulb.edu. And this is an inbox that's managed at all times by our staff here. And it could be regarding immunization questions. It could be questions about our behavioral health department here. It could be about health education. It usually will go to one inbox and we'll kind of funnel it out to the appropriate folks that can answer that question, or just pick up the phone and call us. Also, for any health information, events, wellness tips, we encourage you to tell our students and yourselves too to follow us on social media. We're very active on social media. Oftentimes posting any upcoming events, highlighting our services. We'll do short video clips on things that are relevant for that particular month. And we also have a student health wellness YouTube page where we will save some videos on workshops that we've done, some of our most popular health topics. So yeah, thank you so much.
And thank you for your presentation and being here today. We really appreciate all of the information that was provided. Again, parents, families, and also guardians, we are here to support you and your student in this transition to Long Beach State. So at this time, we'll be answering any questions that you may have. We already have a couple of questions that came in through the chat privately. So my first question for the team would be, my student is over 18. How would I be alerted if a health issue occurs on campus?
That is a good question. If your student is over 18, I mean, with anything in regards to the clinic per se, that's not something that we can disclose. But there is, I believe, I'm losing my words here, but on our website, there is a form that they would need to authorize the release of any information if they desire to. Okay. But, so it's separate from anything that would really happen, let's say, for example, in housing. Yeah, for any of like the visits, anything like that, that stays confidential according to HIPAA, and we're not permitted to release any of that information. But again, I would encourage you to look at, some of those forms that I have talked about on our website. And if it's something that your student chooses to disclose with you, that appropriate form needs to be filled out and submitted to the clinic.
Thank you. My follow-up, the other questions that I have is, if my student has insurance, can they opt out of paying the fee?
Great question. It's part of the student tuition. It's already worked in there. So unfortunately, that's not something that they can opt out of. But like I always tell, students and parents, you might in the moment think like, well, I'm not going to really utilize those services. I don't need it. But you never know when the need might come about. We've had oftentimes students who maybe in a class, they just started to feel ill, not so well. And it really wasn't practical for them to like, well, I guess I'll just wait until I go back home or see my own provider, which could take a little bit longer, when they could maybe just, after class or leave in the middle of, walk on over to student health services or get some assistance to come on over and get seen for whatever it is that's going on. So it is a part already included with tuition.
My daughter has a 504 plan. Where do we submit that information? And how does this information get relayed to other departments?
I'm sorry, I guess, is it a 504 plan? I need a little bit, I'm not quite sure what that is. Can you
If
elaborate a little bit?
Yes, so if that parent would like to elaborate on the chat privately, and then I can provide
Thank
those
you.
details.
Thank
Thank
you.
you. Meanwhile, we're waiting for that clarification. A follow-up question is, how are dental issues covered?
Go, lost my mute button. Okay, great, excellent question. So that is one of the services that unfortunately we do not offer here. Although we do host outreach, we do have a dental health clinic that we had last semester, which was very popular. We had off-campus partners from a dental office come and provide some education around this issue and just kind of created some awareness for some of the services in the area. So this isn't something that we offer here, but if they do have a plan with you and they just need kind of help, like how do I look to see who is in network in the area, that is something that some of our case managers can help them navigate a little bit better, especially if it's further away. You know, if home is not that close by, but they can still locate some services in the area. We can look to see what that is, what network they're in, and get them a provider for the needs that they have.
Thank you. We do have another question. Does the university intake or diagnose students with learning disabilities or mental health issues?
So that's a great question. I would recommend you get in touch with our BMAC Center. We do have a specific department on campus that handles those types of needs to ensure that if there are any accommodations that are needed, that they can work with the student to, again, ultimately have the best possible experience here at the beach. But there are specific criteria that, would need to take place on their own, on their end, excuse me.
Thank you. In terms of the 504 plan, requires special accommodations. I guess this is a question for disability services. Also, we have out-of-state insurance. Is that a problem?
My recommendation, yes, there you go. Thank you, Jesse. He dropped in information to Bob Murphy Access Center. I would definitely recommend that you connect with this team and they can provide you with the steps that you need to just make sure that you've got everything. And this wouldn't be the first time that they would be dealing with this type of situation. So the information is there in the chat for you, but definitely connect with them about those specific questions.
Thank you. And we also have shared a link that would directly provide the information on the website. So if you go to the chat, you'll be provided the link and also the phone number. But I will verbally say the phone number. It's 562-985-5401. Once again, the Bob Murphy Access Center phone number is 562-985-5401. And thank you for providing that link. We do have one more follow-up question. Are x-rays included in the service fees?
I want to say yes. Yes, I'm looking at Erica while I see her nodding. Yes, so they are.
Okay, thank you. And parents, guardians, and supporters, if we have any additional questions, you can continue to add those to the chat. If not, you are welcome to unmute yourself. Great questions. All right, we have a couple questions coming in. Are COVID vaccinations required?
Erica, would you like to chime in for this one?
So COVID vaccinations are no longer required, but they are strongly recommended.
Thank you. May you please provide the phone number once again? Okay. Is there maybe Heidi or Erica, if you can provide the phone number to the
For the
clinic?
For our clinic?
Yes, I'm assuming that's what they requested.
Yes, it's 562-985-4771.
And I will also drop in the chat the email inbox that again we're monitoring it, you know, usually during the week. We tend to get a lot of questions during this period of time, after students have gone through SOAR, and then the parents, sometimes it's like, oh, I forgot to ask about this, or and it might not even be pertaining to the clinic, but you might think like, I don't even remember who to contact about this. You know, go ahead and send us an email, and we'll direct it to the proper individual.
Hey, thank you. We'll have a couple more seconds if we have any questions that we would like to ask, or if you would like to unmute yourself. Great questions. Again, we are here to support you and your student. We want to wish them a healthy transition into our campus. And so we have today Heidi and Erica who presented our information. Again, they have shared in the chat the phone number and also the email if you have any questions after this presentation, or if you like clarification on a particular item that was discussed today. With that, we would like to thank our speakers of today. So again, thank you, Heidi and Erica, for being here, and all of you as well for taking part in our virtual PFO Fireside Chat discussions. If you are interested in participating in other discussions just like today, I have listed our sessions for June, July, and August. We will have the same format, but we'll bring in a campus partner to provide more additional information regarding a particular topic. Again, you are welcome to register. These are completely free. And it's something that we're providing to you, so you are better informed of what we're offering here on campus. If you would have any questions, or if you would like to email us directly, we are providing the information here. You're welcome to take a screenshot, or if you would like to annotate the number. Once again, you can reach our parent and family programs at the indicated number here, and also we have our email. So our phone number is 562-985-5515, and you can also email us at pfo@csulb.edu. We're open Monday through Friday from 8 to 5. Again, if you would like to stay connected with us, we are offering our in-person parent and family orientations. We have included our QR codes. You can also find this information on our website, or again, you can give us a call or send us an email and we can refer to you. Our parent and family orientations are a whole day where we have different campus partners, resources, a tour, and presentations to provide further additional support to you during this transition. Again, we are highly encouraging our virtual PFO Fireside Chats, just like the one today, if you would like to continue doing that. And lastly, if you would like to stay connected with us, we have our Beach Family Portal, where we'll provide different resources, information, and the recordings of these types of PFO Fireside Chats. Again, thank you so much for your time. I really enjoyed having our presenters today and providing information regarding the services offered here in campus. And again, thank you very much. We do have a couple of parents that have privately messaged saying thank you for offering these workshops. Thank you. Thank you once again for putting this together. And then we have some parents who are asking, how do we see the last week's Zoom? I missed it. If you can please send me an email of the person who requested that, and I will follow up with you. We have more thank yous. And then if we can please share the last slide. Okay, so I'm sharing the slide. You're more than welcome to take a picture. Again, through our emails, you can connect with us and we can provide the appropriate resource and also provide any clarifications or further additional information that you are in need of. Again, thank you so much for being here today. We really appreciate our time together and this space. And welcome to the Long Beach State family. We look forward to meeting you in person and getting to know you and your student here on campus. Again, we are here to service you. If you have any questions, if you'd like additional information, we are here to support you and be part of that transition for your student. Again, thank you so much, and we look forward to having you at our next event or resource or orientation. Thank you. And there's more thank yous to you, Heidi and Erica.
You.
Thank you, everyone.